Welcome back from that security. We're going to look at another security, and this time it's security of maternal mortality, security of women and their babies when they give birth to them. Motherhood is supposed to be something of great joy. It's supposed to be a fulfilling experience, but sometimes it is associated with suffering and ill health, and sometimes even death, especially in Africa and Nigeria in particular. To look at this with us this morning, I'd like to welcome the Lagos State Commissioner of Health, Dr. Jide Idris. Good morning. As well as Dr. Yemi Falomo, who is a medical doctor.
Thank you. Good morning.
If you recall, we had him on this program a lot of times during the time of Maternal Abiola, because he was Maternal Abiola's personal physician. Thank you very much for coming, sir.
Thank you.
Good to have you with us.
Thank you.
Now, let me start with you, Dr. Idris. Maternal mortality. I know that the state has been doing a lot about it. There are a number of NGOs also working on it. How much results are we getting from all those efforts?
Well, let me say, a lot of things have been done in the past, like you rightly said. But again, recently, we see seeing that the mortality rate is still very high. So obviously, perhaps we are not addressing the right issues. If you remember, the issue of MDGs, Millennium Development Goals, and maternal and child health are one of the two key goals there. So why people should emphasize on that is just a reflection of the fact that we still have a lot of work to do. So what I would say is that I think right now as a state government we are actually trying to address the root causes of that high maternal mortality rate. And when you know the causes, you can now design programs to address that. And it's not something that you can easily crash overnight. It's something the program and project you have to put in place and let them run for a while, because you're addressing different causes of this.
We're told that in this part of the world there are about 545 to 630 in every 100,000 live births. That is quite high.
Very high.
Now, Dr. Falomo,
Yeah.
when should a woman start attending antenatal clinics?
Well, professionally and reasonably, the woman should go as soon as she knows she's pregnant. It's not 6 weeks or 10 weeks or 15 weeks. As soon as she knows she's pregnant, she should see a doctor to confirm she's pregnant. The doctor will then, tell her when she should be coming for antenatal. I mean, that's really the most practical aspect, but it is not possible to do that for everybody. So, my advice is, when a woman who has never been pregnant before becomes pregnant, she should know something different is happening to her. And of course, pregnancy is accompanied by so many different changes in the body of a normal woman. That alone will make her to go to the hospital. Maybe vomiting, maybe going to the toilet to urinate more than often, spitting. Then that is a must that she must see a doctor. Whether that doctor is a gynecologist or not, that doctor knows exactly what to tell her, how to cope with those events, and be prepared, and not to be afraid of the new found situation in her, because that could be very frightening, right? And to see the doctor at that time, takes care of so many other events that could happen, because we know women develop hypertension, pregnancy. Most of the things that are hidden when they are normal women without pregnancy do come up when pregnancy exists. But this can be nipped in the bud and be taken care of as soon as possible. Anybody saying 3 months, 4 months is postponing it's not right.
I would like to assume that the rate is higher in the rural areas, Dr. Idris.
Yes, it is. And in this environment, I would take Lagos State for example. We have a huge population. We also have rural areas too. And one of in the context of this mortality rate, the easiest way I look at it, what they call the 3 delays. Number 1 delay is delaying accessing care or seeking care, and there are many causes. It could be due to poverty, it could be to education, ignorance, or people like he rightly said too, some people when they're pregnant, they don't even know the signs of pregnancy or with the signs of emergency coming up. So because of that, there's that delay in seeking access. And poverty, ignorance and all, they all thrive in the rural areas. But again, even in the urban areas, you also have delay, the second delay in accessing care or facility itself. And that's why it could be due to transportation, it could also be due to money, it could be due to many things. And even when you access the care, do you have the quality of staff? Do you have the quality, the right personnel? Do you have power? So many things. So to me, the
power just has to be
to me, whether in the rural population, in the urban population, you have people dying for many reasons, and that's why it's essential for any responsible government to address this issue, because we cannot have this rate. This rate is totally unacceptable.
Let me take you off tangent a little bit. In terms of the ranking of the states in Nigeria regarding infant mortality, where is Lagos ranked? Reduction in infant mortality.
As far as I know, I don't think there's any that ranking with respect to the statistics we get.
Okay, so if you look at the MDG goal and the WHO ratings and understanding of who is doing what and where, I know that they have rated Ondo State highly, or maybe Ondo State is blowing their trumpet as having been rated highly. Where is Lagos State in the mix of this?
Lagos State is highly ranked, but again, the peculiarities of Lagos State, many states in this country, even the federal government, do not have the challenges we have.
Okay, what are the challenges for Lagos State?
One is the issue of population.
Okay.
You're having to provide health services to a population of over 20 million people. Now, out of that 20 million people, you have almost 5 million comprised of women and children. Women of childbearing age and children that you need to cater for in this kind of. You need to provide the facilities, primary, secondary, tertiary. You need to provide the human resource to man these facilities. And in this population, there are quite a number of very poor people who don't have the wherewithal to even access these facilities. So you have to provide some kind of financial protection for them. That is their right.
Okay. But if it's any consolation, Dr. Idris, I was talking to a lady this morning who gave birth in the Lagos State Hospital, but the Bagada one to be precise, 4 years ago. And she said the place was hopeless.
At that time?
Yes. And 2 years ago, she went and had her second child, and it was like day and night. The difference was so clear. Water heater, running hot water in the bathrooms, and she thought, am I in the right place? Am I in England or something? If that's any consolation to you, something has been done about the Bagada General Hospital, and people are actually talking about it. But how many more hospitals are receiving that kind of attention, and people are seeing marked improvements such as has been seen in Bagada?
First of all, let me say, I'm going to take just from the different tiers of government, the primary healthcare sector. Nationally, over the years, that sector has been neglected. But we in Lagos State, although at the national too, there's an emphasis on it. But that's the bedrock of any health system. If you don't address it, we are wasting our time. So Lagos State deliberately decided to address that issue, to revitalize that sector. Now, if we revitalize it, we used to have so many primary care facilities that are either run down, non-functional. The idea is to make them functional, build new ones, refurbish, but more importantly, equip them and staff them to make them functional. At the second care level, this is general hospitals. We've even gone a step further. We've now constructed what we call maternal and child centers. Now you mentioned Ondo State. Ondo State has one. They're building the second one. In Lagos State, we have 8. 5 already functional. Yeah. 2. Yes. I mean, the remaining 3 are almost complete. I mean, 2 are ready for commissioning, and we started 2 more to make them 10.
Yes.
So, and these are modern facilities, properly equipped, adequately staffed to cater for problems that cannot be solved at the primary care level, to cater for emergencies, obstetric emergencies, gynecological emergencies, root causes of this high maternal mortality. So at the tertiary level, the care house is undergoing refurbishment now. By the time we finish at the end of this year, early next year, it's going to be totally different. That's the apex of that system, maternal reproductive health system. So that is the commitment of this state, and it's just one aspect of the challenges we feel that we are having to address to ensure that this mortality rate is reduced.
Okay, so if we want to ask Dr. Falomo,
yes.
If you look at over the years, what has happened in a place like Lagos, and then you've traveled around the country,